My name is Josue Diaz, and I'm here to talk about my emergency preparedness topic. And the topic that I chose is the Broward County Unified Telemetry Report. This is basically a cheat sheet that allows us paramedic firefighters on the rescue to give the receiving facility a heads up of what we have and what to expect. The telemetry report has two criteria. It has a red criteria and it also has a blue criteria. All you need is one red in order to be a level 1 trauma, or two blues criteria to be a level one trauma, either or. It also has the adult level 1 trauma criteria and also has the pediatric level 1 criteria. It also has level 2. Level 2 is a different category, and you just need to know the difference. We all have one of these sheets on the rescue. Like I said, this is a great sheet to have on every rescue because we're not going to remember this. And this is firefighter proof. And we definitely need to go over this and be familiar with this telemetry report. I'm just going to go over a couple of level 1 red criteria for you. I'm not going to go over the whole sheet. I'll be here for more than 10 minutes going over this. So in order for a patient to be a level 1 trauma, you need to have one red. And I'm going to go over a couple of the red criterias here. Have the sheet ready. First of all, right here, airway. It all starts off right here on my right, your left. Right here on the airway, it says active airway assistance required. That would be a level 1 criteria, red. Multiple long bone fracture sites. That'll be a red. Second or third degree burns greater than 15% BSA. Amputation proximal to wrist or ankle. Penetrating injury to head, neck, or torso. That'll be a red. Best motor response, less or equal to 4, or exhibits presence of paralysis, suspicion of spinal cord injury, or loss of sensation, or paramedic judgment. I like when they talk about paramedic judgment because sometimes when you take patients there, doctors they look at the patient and they say, well, this should not have been a level 1 or level 2. It's not. It's good to have the paramedic judgment there because we want to err on the side of the patient, where regardless of what the doctor says, it's all about the patient. So determining the level 1. It's good to call a level 1 if needed because the receiving hospital is going to have multiple doctors on standby, ready for an emergency surgery or whatever it may be they do. But it's good to call level 1. They'll have that. Level 2, they're going to have doctors there, but they're not going to be as many. They're still going to do the job if need be. Also, we have a level 2 criteria. No, before I go into the level 2, let me go over some blue criteria. The blue criteria, you need 2 in order for it to be a level 1. So you need sustained respiration rate greater or equal to 30. Sustained heart rate greater than 120 with radial pulse and BP less than 90. Single long bone fracture site due to MVA or single long bone fracture site due to a fall greater or equal to 10 feet. Major degloving, flap, or revulsion greater than 5 inches. Or a GSW to extremities. And a best motor response equal to 5. Ejection from vehicle excluding open vehicles or deformed steering wheel, age 55 or older. Now that list that I just gave you right there was level 2. I mean, not level 2. It was blue criteria. You need 2 of those to be a level 1 trauma. Now I'm not going to go in detail, but right below the level 1 trauma, if that's the adult, you have the pediatric level 1 trauma. You have the red right here. You need one of these. and you need 2 blues, which will be right here. Now below that you have the level 2 traumas, and that level 2 trauma right there, you want to go over that so that you can call the hospital and make sure you let them know what the level 2 is. And level 2 traumas are falls greater than 12 feet, falls greater than 6 feet for pediatrics. The falls greater than 12 feet is for adult. Extrication time greater than 15 minutes. Rollover or motor vehicle crash. Death of an occupant in the same passenger compartment. Major intrusion. Ejection from a bicycle. Pedestrian struck by a vehicle. Adult less than 50 miles per hour. And pediatric less than 5 miles per hour. And that's pedestrian struck by a vehicle. Age 55 or greater, and anticoagulants. So that would be the level 2 criteria, and it's all with a significant injury involved in that. So you have to have a significant injury to the level of 2 trauma. Now, you see that right now I'm looking at this sheet because I don't have this sheet memorized. I go over this sheet periodically, but this sheet is in the rescues. It should be in everybody's rescues. It's great to go over and make sure that the receiving facility knows exactly why you are calling it. Behind it, this sheet here, you can put down the initial blood pressures. You can put down the IVs, IV sites, the Glasgow Coma Scale. It's a very good sheet to use. I advise everyone to use it. This is my emergency preparedness topic. Thank you very much.